Yes, we are live. Terrific. Sorry about the technical difficulties. Facebook has made us update a whole bunch of things. We're having trouble with the laptop. We're going to go back to the phone. The phone, they wouldn't let us on. Finally, we got on the laptop. We're a little late today. We usually like to do it at 1 o'clock. I apologize. You probably heard me, if you came in early, of some of my frustration. So here we are. This is a great, informative Facebook Live. As everybody can see, I'm back in the office. I was in the office last week, so I have scrubs. This is like the second time in my life. Last Wednesday was the first time I ever wore scrubs. Just not something I do. But, you know, just so you all know, CDC suggested. We've got the NK95 mask. We've also got the silicone mask. Sorry about that. There's your silicone mask. Face shield, and of course we have our gloves. Thermometers in the front, so I couldn't bring that. I'm in my office right now. That's why I'm not wearing anything. Doors closed. Basically, just have a staff member here, and believe it or not, if I flipped it around with me, she's still wearing a mask. So I hope everybody had a great weekend. Some really good information. I mean, this could have been an hour and a half long. We're not going to go that long. We're going to go 20 minutes. But I really wanted to talk about the role of the viral load and reducing the risk at home. So as we go longer in the health pandemic, and hopefully the curve flattens, some people are with family members who are sick. So let's discuss that a little bit. If you're a healthcare worker setting, that healthcare worker setting has frequent contact with infected patients. So, you know, my heart goes out to you. Again, please wear all your protective equipment, wear all your hand things that are needed. Again, you're going to be exposed to a higher viral load, and that's something you're going to hear me say multiple times. The more of the load, the greater chance of you getting sick and getting severely sick. So there's a direct correlation between the load and the severity of COVID-19. So it's the idea of the size of infecting dose of virus. So if you were just next to somebody and you brushed up against them and you got a small dose, you may not get that sick, which is interesting. You may not even have an antibody reaction. So that's something to consider, whether you have that antibody reaction or not. So many people say, I didn't feel well. I had the flu. I had some low-level symptoms. My immune system's good, but they didn't get the antibodies. They may have not had enough of a load for those antibodies to come out. So that's another thought process. So two things that you want to put in the back of your head right now. The viral load, how much of the virus are you exposed to? Kind of like a load, like lifting weights. If it's 100 pounds, most people can bench it. If it's 500, there's very few people who can do that. And if the load is low, do you really produce antibodies? These will all be answered in the coming weeks and months as we learn more about this virus. So that's for the healthcare worker. At home, if you're home taking care of somebody, you have to understand that there's a long incubation period. It goes anywhere from 2 days to about 14 days. The average median where symptomology and fever comes out is 5.1 days. We've seen that in the White House where somebody was tested, an aide to the vice president, as an example, was tested and they were negative, and eventually they popped a positive. So that's not uncommon. So you have a high pre-symptomatic infectivity. In addition, transmission amongst family members is very common. So what we're seeing, large families, multi-generational families, families either in, 4 families in one house, or people and I grew up in an apartment in the Bronx, an apartment complex where there's people in your house, there's people all around you, higher incidence of people who got transmitted and caught COVID-19. It's high viral load, but it's really right before the symptom onset. So the study right here showed 44% of transmission came before symptoms. So almost half of the people transmitted the virus before symptoms came out. Now, this is all in the British Medical Journal. This came out in May 6, 2020. The evidence for the viral load, interesting, in that viral load influences the incidence and severity of disease. We kind of covered that. Just wanted to reiterate that. And everybody write this down. Here's your takeaway. I will put this in the comments section. That's funny. I'm going to hit somebody with a like. Looks like a priest. That's funny. Germdefense.org. It's Germ, G-E-R-M, Defense, D-E-F-E-N-C-E.org. Fantastic website. You guys can use that. It'll tell you how to keep everybody clean at home, how to keep your house clean. They trialed over 20,000 people when it came to H1N1. And by following these protocols, they reduced the number of respiratory infections. Infection transmission among family members was lowered in the intervention group. So if you're concerned, you have a family member, or you just want to keep the house a little bit more sterile, if you will, do a great job, germdefense.org. Now, there's some other things that I found fascinating in what we call the emergence of genomic diversity and recurrent mutations in SARS-CoV-2. So a lot of people say it's mutating. They're right. The virus is mutating. They did, and they studied 7,666 people. In that, all the sequences shared a common thread or a common ancestor, which went anywhere between October and December from China. Interesting. They had 198 filtered recurrent mutations. So it's mutated 198 times. However, it mutates and comes back to the original 80% of the time. So it's very interesting. It has mutated, but its only end mutation is about 20%. So it's interesting when we talk, and again, I know everybody has their opinion. I'm not giving mine on vax, on drugs. Everybody knows I'm an alternative doc. I like a lot of building in the immune system, things of that nature. But I would strongly recommend everybody understand that this particular virus mutates. So if anybody just checked in, I'm in the office, I'm doing the scrub thing. There's the mask. There's the shield. So that's why you're not seeing me with clothes or sweats or anything like that. And that's why the hair is, the face shield doesn't work with the hair all that much. Having said all that, really interesting update on vitamin D. Vitamin D and COVID-19 mortality rates. Vitamin D deficiency. So what do I call deficiency? Well, I would say below 30, you got a problem. And there was a grassroots study that really spoke to the idea of 30 and over really precipitously decreased the incidence of COVID-19. Having said all that, vitamin D deficiency is directly correlated with mortality. So everybody, vitamin D3, 5,000 with K2, let's go. In addition, the vitamin D deficiency was directly correlated with the decrease of the cytokine storm. Cytokine storm, a hyperinflammatory condition caused by an overactive immune system. So many people get confused. They think the virus causes the cytokine storm. It's not the virus that causes the storm. The virus causes cytokines to come out. Our body's immune system is not responding appropriately. Either our immune system, our innate immune system, is overactive, and our adaptive acquired immune system is underactive, and that's typically the scenario. Therefore, we keep sending cytokines, and those cytokines actually squash and damage the alveoli of the lungs and damage the lungs, and that's what we're talking about, that cytokine storm. The storm really isn't coming from the virus. It's the body's inept, inappropriate response to the virus. Having said all that, one of the best ways for our immune system, our innate immune system, to function well, and the balance between the innate and the adaptive acquired immune system, is vitamin D. So we don't want to be deficient in vitamin D. It's interesting, the study really spoke about how it enhanced our innate immune system, and it really prevents us, once again, from being overactive. So the conclusion of the lead investigator with vitamin D, very simply said, our analysis shows it might be as high as cutting the mortality rate in half. Who doesn't want to take vitamin D now? It will not prevent a patient from contracting the virus. Big takeaway. It may reduce complications and prevent death in those who are infected. So clearly one of your best choices to take as a supplement would be vitamin D, and get your vitamin D3 levels checked. What else is really interesting is having a staff member who had coronavirus, but yet the child, everybody in the house got it. Some actually even got pneumonia. Why did the baby, just a little over 2, just get a little fever and it go away? Because children don't have a fully developed acquired immune system. They only have an innate immune system. And by only having an innate immune system, that's the only thing their body has to fight it off. And because of that, and believe it or not, higher melatonin levels, the children, when I say children, 2 and 3-year-olds, are not as or apt, if you will, to getting COVID-19 symptomology. So it's very interesting that they haven't got that acquired adaptive immune system, because much of the autoimmunity is in that second half of the immune system. So guys, don't forget, any shout outs, really good. Sorry we were late today. Let me know that you're there. Feel free to ask a question, comment, share the information, because for me, this is leading edge information. I'm trying to keep it jam-packed within 20 minutes or less, because we were late, and I know everybody's kind of like going back to work, and those who are going to, I got a couple of people who just texted me that said that thought you weren't at 1 o'clock. However, we're on now. You can see we fixed the laptop, and we're going to go fix the phone momentarily. So a lot of people asked, why men versus women? Why are men so much more susceptible to COVID and get a more severe case of COVID? About a week and a half ago, we talked about estrogen and estradiol, and women's hormones really have shown to decrease their poor response. They're actually more virulent against a virus because of their hormones. So much so that there are some New York hospitals giving men estrogen and or progesterone. In addition to that, they used a swab test here on 68 subjects. The median age was 37 years, pretty young. 48 were men, 20 were females. Females were able to achieve viral clearance significantly earlier than males. So family members were also studied. Here's what they found. The ACE2 inhibitors are the ACE2 receptors. Those are the receptors that the virus is able to lock and key and go tight, 10 times tighter than any other previous virus that we knew. ACE2 receptors, the highest sites, men's testes has one of the highest sites of ACE2 expression. So we found out, and we're now theorizing, that those have ACE2. That is a repository or reservoir for the virus. Not really an exciting concept being a male. However, there is one question now. That question is, those with vitamin D in the 40s levels are more susceptible. No, actually, the study really showed, great question, the studies really showed that it was over 30 was good enough. Now, for me, optimum numbers, there was another study that talked about vitamin D and said its optimum numbers should be between 40 and 60. For me, I like between 60 and 80 in my patients, which is a substantial increase. Most people come in anywhere, believe it or not, from 12 to 25. They're really low. They are, without question, low. So I'm a big proponent in raising vitamin D levels, D3, 5,000 or 10,000 with K2, as I said. But getting back to the news, really speaking to the idea of men versus women, the testes are an issue. Now, having said all that, coronavirus is found in infected men's semen. Now, they said it's prevalent in the semen, but that doesn't mean the virus can be sexually transmitted through contact with the semen. So it must be confirmed that there is an infectious virus, not just a virus product. So now that's another thing. You may see a surface area, and the virus may be there, but the virus may be present, but it may not be potent, so it can't be infectious at that time. Again, we're sifting through a lot of the different literature. We're looking at a lot of the different things that can lead us down a path of really even understanding the virus more and more and more. So once again, sorry for being late. A lot of technical issues. Any questions, any shout outs, anything like that, feel free to let me know. You guys are doing a great job. I get a lot of questions later. I'm trying to get them where we can handle them right now so we can answer them so I don't have to share later. Once again, let's go through my affiliates. We always do a great job. We're in sync with Creative Chiropractic, Dr. Mike Warren and Mike Powell in Medford, Oregon. And of course, always our friends at 8 Weeks to Wellness. So I see that we have a lot of people I threw off by coming in late. I promise tomorrow we'll be on time. At least the computer's working. So having said all that, hope to see you guys tomorrow. Dr. Rob Silverman, always yours in health.